So there we go. So many of you know that Philips Lifeline is the leading medical alert service in the industry. It was founded in 1974, and since that time, we've served over 7.5 million clients. We now have over 700,000 clients throughout North America, each of them identifying 3 responders that they want notified in the event of an incident. So if you do the math, that's about 3.5 million people Lifeline touches today. So, about 5 contacts per client. Every year we take about 9 million calls, many of which are for social support, but approximately once every minute, Lifeline is sending assistance into a home somewhere in the country. So we're either calling a neighbor, a family member, or even the emergency services for assistance. Well, I guess I could dive in. So one of my colleagues starts his in-services by asking a question. He'll say something like, one of your patients has fallen at home and is lying on the floor unable to get help. Which patient is that? And then he'll just jump in and be like, the answer is the one without Lifeline. When I first heard that, it kind of chuckled, but then the more I really thought about it, he was right. And during this presentation, as I'm talking to you, Lifeline will be calling for help for at least 60 clients. And that's for an emergency service, not just a regular, hi, how are you doing, or I'm just testing my button. So actually, if I could go back to the last slide. So what I do want to highlight is the most dramatic value that Lifeline provides is the potential to save somebody's life. We're not just a basic help button. So and that holds so true that we are proud to say that our services are being used by Betty White and the father of talk show host Lisa Gibbons. So Betty White actually just utilizes our services. She herself has not had an incident, but Lisa Gibbons' father used his button in the event of an incident and it basically saved his life. If you'd like to learn about that, you can go ahead and onto our website and there's a brief video with him and the physician as well. How do I click to the next one? So during this presentation, I'd like to cover why is Philips Lifeline focused on falls, the impact of falls, our retrospective study, the link between medications and falls, and making a difference with the Lifeline products. So I'm going to try not to get into too many stats, but many of you know that there are 2 serious threats impacting independent living for older adults. So we have falls and we have difficulty managing medications. Earlier I mentioned that Lifeline receives 9 million calls per year. What we discovered is that half of those help calls are related to falls. That means 4.5 million calls were assisted within 22 seconds. So whereas individuals without a help button can go hours, even days without receiving emergency medical attention. Studies show that it can take a patient anywhere between 2 and 72 hours to receive help. Solutions that automatically alert an emergency response center can quickly provide help to seniors. So giving their caregivers and families peace of mind and can potentially help prevent escalating medical conditions. So as you can see in the diagram right there, the response time can depend on the support network that the individual has in place. So someone without a help button can take 2 hours before they notify someone for help, whereas it would take 4.5 hours for a friend to learn of an incident, 9 hours for a family member, and up to 72 hours for someone like a landlord. So just think about your household. How long would it take for someone to know that you needed help? I like to think, I'm the last one that leaves my home, and then with traffic and everything, someone doesn't come back to my home about 8 or 9 hours later. So if I had an issue or a fall, it would take 8 to 9 hours before someone would help. So why is rapid assistance important? Why do we at Lifeline strive to decrease delays between falls? And I'm sure that the clinicians on this know that it's to decrease lie times. So as the slide kind of shows, about half of older adults who fall cannot get up from that fall. Lying on the floor helpless for long periods of time can have serious medical consequences. We all know long lie times increase seniors' risk for pressure ulcers, dehydration, breakdown of muscle tissue, and sometimes even death. But what we at Lifeline are focusing on now is the condition that causes the fall. We all know that our help buttons can assist in decreasing long lie times, but what can we do to step ahead of and be ahead of that unpreventable? What may be causing all of these issues? So instead of just the basic fall. Oops. So how many times have the folks listening in right now, have you talked to a case manager, a patient, or a loved one about fall prevention, high fall risk clients or history of falls, and have gotten the response of, I don't fall, or, I really don't see many people with histories of falls? It can get pretty frustrating when you know that the stats out there prove otherwise, that there are a high number of falls. So because of these responses, we have taken kind of a new approach. So personally, I like to try not to use the F word, because falls seem like a bad word when it comes to seniors. There's a stigma that falls mean they cannot be independent in their home anymore. And with case managers, it's the most used word that it's become so common, its impact is not as significant as it used to once be. Before I highlight some causes for falls, I want you all to look at the picture on the screen. So let's just pretend it's a movie. And I want you now to just try to rewind the image maybe 10 seconds back. And then hit play and see the little lady in the yellow sweater fall. So how did you imagine that fall? Did you just see her as, being the damsel in distress and just kind of like falling to the ground? Or did she slowly walk to the staircase, grabbing her chest? Or perhaps carrying her tea in one hand while the other was to her head, feeling faint? Or was she standing there taking short, sharp breaths before she fell? Well, many of you probably saw just a little lady just fall to the ground, and there's nothing wrong with that. You'd be surprised how many people actually, when I do this little bit, that's what they play. They see somebody standing there falling. Hold on a second. So what we at Lifeline, what we're doing is we're looking at our data and we're peeling back those layers to really see what is causing these falls instead of categorizing and defining everything under falls. Because of this, we no longer ask individuals, are you at risk for a fall or have you had falls? We ask, do you have any of these conditions? So as you can see, that's quite a bit, and this is just kind of what I put together in maybe two minutes, what I was able to throw out there. So there really are numerous reasons and conditions which may lead to a fall other than history or mobility issues. So now I want you to think about, how many of you currently have patients or know someone who's a diabetic? Of those patients, how many of them have uncontrolled sugar levels? Now, how many of those are maybe 3 or more medications? Have they felt fatigued, dizzy, or lethargic recently? Those are all conditions that may result in a fall. So, and as we all know, these are all forms of chronic conditions. So, let's see. Sorry about that. So to better understand the link between falls and causes, Philips conducted a retrospective study. And I'm not going to go too deep into it because, as we all know, studies can have a lot of data and just can really go over your head. But so our study was the self-reported fall rates of more than 145 seniors using only our Lifeline products between January 2012 and June 2014. The study reveals surprising new data linking seniors living with chronic conditions to a greater risk of falls. It also shows that seniors with mental health and respiratory conditions recorded higher instances of falls over those with simply mobility problems. So hence our new approach of discussing chronic conditions and side effects over, do you have a history of falls? The fall risks analyzed by the study were based on more than 7,000 falls that the study populated experienced between the 2.5 years that we conducted the study. So what I'll next be covering are kind of the outcomes of that recent study. So not to preach to the choir, it's pretty evident that the number of seniors living with chronic conditions is on a rise, which in turn is increasing the risk of falls. So through the Lifeline study, we were able to determine that seniors living with 5 or more chronic conditions have 40% more falls than those that did not have any chronic illness, whereas seniors with 3 chronic conditions had 15% more falls that required transportation to the hospital. That's pretty big when you have 72% of people with 1 or more chronic conditions. The data also shows that the top chronic condition that causes a fall that needed to be transported wasn't due to mobility. It was cognitive impairment at 54%, COPD at 42%, diabetes at 30%, and heart conditions at 29%. So as you notice, some of these mirror the diagnosis that we're all seeing with high readmission rates. However, cognitive impairment is not the number one reason that they see, but it's what we've been noticing an increased trend. So think of the current clients or any of your family members and how many of them have more than 1 chronic condition. I mean, I just think of my dog and he has 2, and that's an animal. So really the lives that we touch day to day, you're looking at more than 2 or 3 chronic conditions. So how about, or what about those diabetic individuals we thought of in the previous slide? How can clinicians, caregivers, and family members collaborate to help prevent accidents and to be better prepared by anticipating falls and other medical problems? So we've discussed the links about falls and chronic conditions, but what about the medications that manage those conditions? So in this day and age, we are hearing about the need to reduce emergency department visits and hospital readmissions. So especially when 1 out of 10 older adults hospital admissions may be due to non-adherency for medication, and 40% of those nursing at home admissions are associated with inability to self-administer medications. And we all know seniors are always discharged from a nursing home with either new medications, dosing changes, or different time schedules. Now consider how taking 4 more medications increases that individual's risk increases their risk for a fall by 30%. So again, folks with more than 2 or 3 chronic conditions generally have 1 or 2 medication for each condition. So already that chronic condition increases their risk for a fall, and now we're adding higher medication, which that also increases their risk for a fall. So I guess I'm just not going to go through a lot of the stats that are on the left, but I'd really like to talk about the building blocks on the right. So what Philips did was we worked with several pharmacists across the U.S. on being able to determine, the medication, how medication impacts falls, and how can we categorize that to better understand. So as you can see on the top, we have drug interaction. So for example, 2 or more medications that affect the central nervous system, such as antidepressants, medications for sleep, or certain medications for high blood pressure, when taken at the same time, can result in dizziness that cause balance problems and falls. The next block, we have overdosing. So overdosing is another medication risk factor. Some are unintentional, like confusion or forgetfulness. Sometimes it's intentional, and sometimes it's due to gaps in the healthcare system. So lack of communication between providers, especially when folks are bouncing from a hospital to a nursing home with healthcare, with caregivers, or you have a daughter from one town taking care of mom, and then you have a son from another town taking care of her. Next, we have underdosing, which occurs when medications are taken sporadically or doses are missed for various reasons. We're all too familiar with the next block, inappropriate use. So basically taking a medication that belongs to someone else in the household, or perhaps taking an outdated medication. The green block touches on incorrect timing, so simply taking a medication at the wrong time. And lastly, not following instructions, which can lead to all of the above issues. It's obvious that chronic conditions and medications play a major factor in falls, but as you can see, the more complex and the more blocks you add onto one another, the likelihood of them falling. So, much like our clients. So then what next? How can the Lifeline products assist? The reality is that not all falls can be 100% prevented. However, Philips Lifeline offers a suite of in-home technologies that help deliver, monitor, track, and coordinate one's medical care. It's been said by a few caregivers, and I'll talk on those bullets, that our products not only save time, it makes providing care easier logistically, such as our medication dispenser. It also gives them peace of mind, as well as giving them the feeling of being effective and reducing stress during a difficult time. So let me just talk about some of our amazing products. So Lifeline's suite of in-home monitoring services offer the right solution at the right time. So these products include our HomeSafe communicators, which you will see on the top left. Our communicators can range from our landline for folks who have a landline to our wireless for those that do not have a landline. The unit has an AT&T SIM card built into it. We also have our upgraded capabilities of our AutoAlert fall detection pendant that can be added to any of the communicators. And then we have our GoSafe pendant for the seniors that leave their homes for extended periods of time, along with our medication dispenser, which some of you may know as the MD2, and I actually like to call that one the Beast. So let me talk to you a little bit about the benefits of our service and how they work before I dive into the products, just to give you an idea of kind of what goes on behind the scenes. So every client wears the standard help button, and they have a Lifeline communicator in their home. If they need help, they push the help button, which sends a signal to the communicator. The communicator then seizes the telephone line and calls our response center that's located outside of Boston. We are in the US and we have backup folks, so they're always getting somebody. On average, our response time is less than 30 seconds. A response associate speaks to the client over the two-way speakerphone in the communicator. They assess the situation and call for the help needed. So this could be a neighbor, a family member, or even the emergency services. Then depending on the outcome, the response associate follows up to confirm what help arrived and basically to close out the call so that we have record of what happened. Was there a hospital transportation? What hospital did they go to? Did the daughter show up? Did she help mom with the issue? And then also to let you know that our response associates, we have English and Spanish and several other high languages, but we also have partnership with Language Line, which offers us translators of 95 different languages. So that way your folks are not, when they call in, we are getting the appropriate individual. So we've actually seen an increase in Navajo, and that's nice to know that we have those capabilities. So to get into the products a little, I'd like to talk to you about our AutoAlert. So having the protection of AutoAlert can make a significant difference for patients who fall or who have medical emergencies and cannot push their button. AutoAlert is designed to call for help automatically when it detects a fall. So the help button detects greater than 95% of falls. It is the most widely adopted fall detection technology on the market today. And AutoAlert reports twice as many falls as standard PERS. So I'm going to say that one again. It detects twice as many falls as standard PERS. We can say this because this is data that we've used internally, which is pretty scary when you think of it. Our fall detection has detected more falls than what individuals actually push their button for. So now let's take a closer look at how it works. I'm not going to get too into the techie language about the accelerometer, but I just want you to see how, if a patient falls or has an emergency, they can get help in two ways with the AutoAlert pendant. They can push their button to activate the communicator, which is just like a standard help button, or the AutoAlert detects a fall if the client cannot push their button because, let's say, maybe they were disoriented or unconscious or they physically couldn't push the button. then the auto alert will automatically activate the communicator. So there's a 30-second delay before calling the response center. This gives the client a chance to get up on their own, which respects their desire to take control of the situation if at all possible. If for any reason we do not sense movement, then our response associate is coming over the phone. So what about your clients that are a little bit more active, or those that do not have caregivers or are not allowed to go out in the community on their own? This is where we have our GoSafe button. So we offer a solution for those individuals that are a little bit more active or without any assistance. So much like all the other buttons, GoSafe's lightweight, senior-friendly, easy to wear, and waterproof. The design also has the added layer protection of AutoAlert, so it can detect falls as well, even out in the community. So in addition, GoSafe leverages up to 6 advanced location technologies, which enables the fall detection to help and allows it to work outside of the home. So I'm just going to briefly talk about those location technologies. So we have our assisted GPS as well as in-home communicator. When the individual's in their home, the button becomes into in-home mode, and that's basically how we know if the person is in their home. We have what we like to call intelligent breadcrumbs. So this is snapshots of where the client has been going. So in an event, we can see that maybe they crossed the alley or are going a certain way, and at least this way we can kind of get an idea of where they may be going. We have our Wi-Fi enhanced locations, our two-way voice communicator, which is on the pendant. So when the pendant has detected that it's in away mode, so it's not in the home, someone will come up extremely loudly over the pendant and you can communicate with them there. We also have the audio beacon that can be alerted. So if we included that in the instance of someone falls in a park and we can't exactly pinpoint their exact location within that park, we can activate the audio beacon, which will then send out a high-pitched sound so that someone can go ahead and find them. So, so now that we've talked about our help buttons, what about the individuals that may need a little bit more assistance than that, or maybe even outside of the help buttons? So this slide basically has everything that our medication dispenser is, so I may just go ahead and read it. The Philips medication dispenser, which we call the PMD, offers a high-quality, user-friendly, and proven system that can help reduce the number of medical complications and hospitalizations. So remember those folks leaving the hospital and the nursing home with all those medications? This is where this medication dispenser would help out. So it's ideal for individuals who have recurring hospitalizations related to medications, complicated medication regimens, 4 or more medications, or even just cognitive impairment. And with this, we've also seen it's helped tremendously with caregivers. So, and it's alleviated some of that anger and stress with family members of them telling them what to do, even though the individual may be able to take their medication by actually putting in the medication dispenser in the home. It gives them a little bit more freedom. It lets them be the ones to choose to take their medication, and at least this way that it eliminates and removes some of that anger and resentment towards those family members. So next I'm going to point out some of the key features of the PMD machine. So not to just go by all the bullets, but the medication dispenser can dispense up to 6 doses per day, and it can hold up to 60 dosing cups within the tower. So a dosing cup is defined as an actual dose, and each dosing cup can hold about 25 medications in it. So someone who takes 15 pills in the morning and maybe 4, let's say 4 pills in the evening, this medication dispenser will hold up to a month worth of supplies for them. So it accommodates PRN, reminder of non-pill medicines. So if someone needs to take their insulin, perhaps take with food, there are different alerts you can program in there, as well as the dosing dates and times of when the medications can be dispensed. The medication dispenser, even though it's big and bulky, was designed to be user-friendly. It's easy for individuals who have difficulty hearing. The audio and visual reminders on it's loud and bright. The dosing cups are easy to open, so for individuals who with dexterity challenges or just extreme weakness. And then our medication dispenser is also created for caregiver engagement. So as I was mentioning before, bringing in that caregiver to assist, so they can actually monitor the usage on the medication dispenser via our secure online portal, and we can insert caregiver alert. So if, let's say, mom forgets to take her medication, we can include on their list of folks that we are contacting to let them know a dose has been missed, or they have not been taking it at all today, or maybe they just turned it off. So that's a big thing that we've included within the system. Of course, it has the safety features of the locked cabinets, so any missed doses get set aside, so they're not just all coming out at once. And most importantly is a rechargeable battery within the communicator. So if someone were to unplug it, the machine is still actively working. If for any reason power is to go out, it is actively working. When the power comes back on or when it's charged back in, the medication dispenser will go ahead and just recharge itself again. So as I mentioned before about caregivers and the increased caregiver engagement we've included in the medication dispenser, I'm going to just kind of wrap up my presentation by really just highlighting something that, again, we all may know, but the studies that prove that effective community care teams empower both caregivers and patients in the transition planning process. So we're talking, hospital to home and everything in between. Community care teams include any of those items that you see on the screen right now. So from home care, outpatient rehab, hospitals, nursing home, physicians, effective community care teams that help the senior with the ongoing management of their chronic illness, which aids with the prevention of a hospitalization and hospital readmission. So not only are our services important, but every single one of the factors or any of these individuals or areas that are highlighted on the screen to help really with the individual's chronic illnesses. So, most people with multiple chronic conditions, which are often accompanied by functional and cognitive defects, cannot manage their care on their own. They rely on family caregivers and others within the community care team to help them navigate transitions and coordinate complex care in their community. So, that's why it's key. If 2 of the 7 people in the person's community care team assist in the education and setup of a help button or a medication dispenser, not only are you improving on the senior's quality of life, but ensuring a longer and safer way of living independently in their home, which is basically what we all are here for. I may have been giving you a lot of information, and I talk about this day in and day out, so I may have kind of just breezed through it, but I hope I was able to provide you with information that may assist your clients and caregivers when it comes to medication management or help buttons or let me see, I think I do have one last slide. Oh yeah, so there's my contact information. If you have questions that you think of later on down the road, that's my corny photo, as well as that is our intake team. That is our team for Colorado. Not that many of you will utilize that, but that's just kind of our information. Also, if you'd like more resources on getting up from a fall prevention, any educational pieces or handouts to give to a caregiver or give to your loved one, you can click on the link, which is just basically learnnottofall.com, and there's a lot of helpful resource information on that. So,
alrighty, thanks, Evelyn. So I'm going to open it up. We're going to open it up to questions, and it looks like we've got one from Michelle. I think you hit this a little bit on the front end, but if they are not seeing cognitive issues being the cause, what are they seeing as the cause? Just balance then. And I think Evelyn alluded to, there's a bunch of chronic conditions, diabetes, CHF, COPD, potential nausea, blood pressure, You had a whole bunch in there.
Yeah, there's a lot of reasons that could lead to a fall. So what our let me just kind of explain. So the way that our study was, we currently right now when folks push their button, we categorize everything. So they push their button because of a fall. They push their button because of difficulty breathing or chest pain, and then we actually document what was the end result. So we have all of this data, and that's where our study came from. But we were trying to dig in deeper as to, we know falls are the #1 reason, but what is it that was causing the falls? And that's where we basically came up with chronic conditions. But as we all know, they stem from anything from the cognitive portion to the medication, and then what are the symptoms? So the symptoms are confusion or weakness or difficulty breathing or fatigued. And those are what we realized were the key words, the key factors to really look into when trying to identify these folks, of asking them and talking to them about, do you feel weak at times? Have you had shortness of breath? Instead of, do you have a history of falls? Or have you fallen in the last 90 days? Which is what we're all kind of programmed to ask. So that's kind of what we uncovered in that study. So I hope I answered that question.
Hey, one of the questions that we get out in the field a fair amount from both seniors as well as some of the community members surrounds the fall detection systems that are available as far as false positives. Like somebody, maybe they just trip, they don't necessarily fall. How does Philips approach that as far as, you have a 95% fall detection? Do you have false positives, or do you get any complaints or concerns from seniors about that?
So yes, so that's at 5%. Just to back a little too, a lot of the times when you're offering the services, some folks may say, no, I don't want it. I had one before and it went off all the time. It's always good to ask, what product was it? Because some of the products are actually ones that you clip onto your belt or you wrap around your wrist. And with that, you increase the likelihood of false positives. So that's why our help button is strictly a pendant that goes around the neck, because what the pendant does is it gets to learn that individual. It gets to learn their height. It gets to learn their movement. It gets to know when they sit up, when they sit down versus when they lay down on a bed. And that's where we're able, when I said not to get too techy, we're able to put that in with the accelerometer and our algorithm to determine what is a true fall. And that's why we've increased it to 95% accuracy. There are those times when folks will plop down on a chair and it will detect that, it will trigger that fall. And if we don't see movement in 30 seconds, then we are coming over the intercom. But then that's kind of an educational learning opportunity of letting that person know. Plopping down may not be the best thing, which then in turn will help decrease the number of incidents that are provided. So someone asked the question of, is Philips working on the elevation issue? Yes, we are. So over a certain amount of feet, and I believe it's 60 to 100 feet elevation, we start to notice some of the false positives where the accelerometer will start detecting falls that are not true falls. Because of this, we currently have a production team working on that, especially for us here, like in Colorado. We try to tell people still to offer the AutoAlert, because the false positive is better than an actual event happening and them not being able to push their button and then just being, just having that lie time. Again, it just depends on how frequent those false positives are. From my understanding, the last reporting I pulled, because I've been helping with this initiative, we have been seeing about 15 a month for some individuals, which is a lot, and to be just transparent. But again, that you're adding that added layer of protection of some detection. So some of these folks have been okay with those 15 false positives, but they do so because they worry of the time when they do fall and they are unable to push it. Any other questions or? I don't know if we have many caregivers on the line. I guess I didn't really cover this, but I will briefly discuss this. So we have PeopleCare as one of our vendors who utilizes our services and puts it out there. And what we do is everybody has to go through a certification process. And in doing so, they learn a little bit more about how to provide these products, how to best utilize them, where's the best location to really put them in. Our wireless unit will not activate itself without signal strength, so it ensures that the individual actually has good strength when they need it. We really don't like to tell people that it comes with a SIM card in it, because we still like for them to continue to pay for their cell phone, but that's the nice added benefit, that the communicator itself is a cell phone. So for snowbirds, it's easy for them to take with them. But being part of Philips Lifeline as a vendor, PeopleCare had to go through extensive kind of certification to be one of our vendors. And part of that is asking the questions outside of the clinical, what are your current medications, what are your allergies, but asking the questions of, in an event of an emergency, who would you contact? So a lot of folks would always say their children, but really it's, again, as I mentioned before, peeling back those layers and asking a different question of, if you fell tomorrow, who could come help you in the next 5-10 minutes? So, and that's kind of gives you a little light into our installation process, as well as, where do you frequent? So let's say, I like to be out in the garden. I like to check my mail. We check to make sure that the individual's button actually works in those areas. And if it doesn't, then it's letting them know where the barrier mark is. So that way they know in the future, if they were to fall for any reason, my help button would not be detecting the range out this far. But usually it can within their home distance.
That's a good question on the PERS. What is the range for, say, the GoSafe buttons? What is the normal range with good cell coverage, or even if they're using a landline? How far away from the communicator can they get?
So if they're using any of the standard buttons, we say a football range, but it varies. I live in the cookie cutter development, and I actually can push the button and it can be detected several houses away. So it just varies on the home. If it's a brick home, I actually was doing an in-service in Phoenix and pushing a button, and it was making the response associates mad, because I was just doing in-services up and down to senior living, and every building that I went down, it was actually detecting it. So the range depends. As far as the GoSafe button goes, which is the one for the community, that basically almost works everywhere. I myself have a GoSafe. I use that when I go on hikes. I prefer that over a cell phone. It's easier to clip on the dog's collar, and I've actually had to use it once. So, and in Flagstaff, so it worked.
Cool.
Any other questions? Any
other questions out there? We've been in about 40 minutes. I'm not seeing any chats. I've unmuted everyone, so if anybody wants to just ask a general question, they're certainly welcome to. All right. Okay, I'm not hearing or seeing anything, so I think we're going to go ahead and close this out. I'd like to thank Evelyn from Philips for the information, and Evelyn is obviously always available. If you guys need to reach out, you can reach out to me, Phil Gibson, at philg@peoplecarehs.com, and I can get any questions that you might have over to Evelyn. This will be recorded and put out onto our YouTube channel, as well as a link through the website. So please feel free to, if you want to recapture some of the information, you can. Thanks again, and have a great day.